to noon as possible. Let's aim for that at least. There are some other things we do need to attend to. Now, there were 766 new cases yesterday. All of them are locally acquired. That brings us to a total of 6,666 active cases across Victoria. I'm sad to have to confirm that a man in his 80s from Moreland, a man in his 70s from Hume, a man in his 80s from Hume, and a woman in her 90s from Hume have all passed away. I extend on behalf of the government and all Victorians our deepest sympathies and condolences to their families. This will be a very difficult time for them. There are 257 people that are currently in hospital with COVID-19. 60 are in intensive care and 41 are on a ventilator. We send our best wishes to each of those people and, of course, to the teams of dedicated professionals who are caring for them every hour of every day in very, very challenging circumstances. Of those cases, that is to say yesterday's cases, 81% were not vaccinated, 15% were partially vaccinated, and just 3% of people were fully vaccinated. There are 3% is actually a bit higher than it would normally be, and I think the Deputy Premier noted yesterday that there are a number of people who have come from aged care and have a number of underlying conditions, but even at that number, what the very clear pattern is, if you are fully vaccinated, you are far, far less likely to find yourself gravely unwell and in a hospital, let alone in a critical care bed or an intensive care bed. In terms of tests and vaccines, big day of testing yesterday, 62,408 results were received, thanks to everybody who's gone and got tested. That's a fantastic turnout. The number's been very strong. It gives us a more complete picture, helps us to isolate and limit the spread of this virus. I know it's a process, it's a thing to go through, and we're very, very grateful for people doing that, and of course to the teams of people doing that testing work. 40,957, so just shy of 41,000 vaccines were administered in state hubs. Fantastic effort. People continue to turn up in very, very strong numbers, and that's why we're able to report today that we have moved to 75.2% of Victorians 16 and over have had at least one dose, and 45.6% of the Victorian community 16 and above have had both doses. They're fully vaccinated. Now, I have some announcements in relation to border permits. I know that the number of people who've been, in essence, trapped in New South Wales for a lengthy period, we have on numerous occasions sent our apologies to them and made it clear that we understand just how challenging it is and we wish things were a different way. Well, following advice from the Chief Health Officer, I can announce today that new rules will come into place from the 30th of September, so that Victorians in an extreme risk zone, which is basically Sydney at this time, will be eligible to return home to Victoria if they are double vaccinated and if they have a negative test 72 hours prior to leaving New South Wales to return back to Victoria. They will have to do 14 days of quarantine, but that quarantine can be done at their home. If a person does not have a place to go to that's safe, well then we would try and make arrangements to support that person. But it's essentially home quarantine if you've double vaxxed and you've got a negative test within 3 days of coming home, then that all begins on the 30th, and those several thousand, we believe, those several thousand Victorians that are in Sydney that are from Melbourne or from Victoria will be able to return home. That's a big step forward. It's been, I know, a real inconvenience and a real challenge for those people and their families. And we've said so many times, and we've meant it every time, we don't want to have people locked out of their state, and we don't want people locked into their home. That's why vaccination's so important. That's why ending these lockdowns, getting people home, getting people open and free, having our economy function as it should, all of those things, they're all critically important, but they're only possible if we continue to drive these Pfizer, AstraZeneca and Moderna vaccinations up. And the good news is that's exactly what's occurring at clinics right across the whole state. Now, there will be rules, of course, that home quarantine is serious. It's not a matter of when you feel like it. It'll be proper, 14 days, and there'll be various mechanisms to check on people. It will not be technology enabled. We don't think we need to do that. We think, however, given the number of cases that are here, the number of cases that are in New South Wales, the growing vaccination numbers, and our proximity, if you like, to those first dose 70% double dose and 80% double dose, so the first and second double dose thresholds, this is a proportionate and the right thing to do. So I'm very pleased to be able to announce that today. And if there's any further information that we need to provide, then of course we will update you. Can I just again very briefly thank all of those who are working in testing clinics, in laboratories, working in vax hubs, working in hospitals, working on the front line as members of Victoria Police, in everybody across the team, contact tracers, everybody who's doing an amazing job. They're all doing their very best, and I'm grateful to them. We did see yesterday some appalling behaviour down at Town Hall, where a number of people who are vaccinating vulnerable Victorians were treated appallingly by some people pretending to be legitimate protesters. That's not called for. These people are doing the very best of work. They're vaccinating people, for heaven's sake. They're providing people with close to certainty, not absolute, but close to certainty that they will not become gravely ill. Why would you abuse, why would you, as I'm told, be spitting on people who are doing that sort of work? That's ugly, it's uncalled for. I'm not sure whether those people can be identified, but if they can, it'd be my expectation that Victoria Police would deal with them. Can I just, before I throw to the Acting Chief Health Officer, can I again, as I did yesterday, can I thank every member of Victoria Police for the outstanding work that they did yesterday in very challenging circumstances. Can I also, because I think it can't be said enough, can I also send my best wishes to every family member of Victoria Police. Every police family across this state will be anxious at the moment to think that their loved ones doing their work, doing their job with their skills and their commitment and their passion to keep all of us safe. It's a difficult time. It's a challenging time. So they're in our thoughts as well. But police were very effective yesterday, and I thank them for putting themselves in harm's way to keep the rest of us safe. I would hope that today and in days to come, there's not a need for that, that instead people are following the rules, doing the right thing, so we can get construction open. That's what we want to do. That is our aim, and I'm confident that we'll achieve that. My reports, just before I go to Acting Chief Health Officer, my reports are that there's plenty of high vis, not so much at ugly protests in the city, but out in state vax hubs, in GP clinics, in community pharmacies, getting vaccinated so they can get back to work. And what's more, getting vaccinated so they can stay safe and not be making the job of our nurses harder and not be potentially contributing to very serious ill health of someone they love. There's every good reason to get vaccinated, and it's so pleasing that so many Victorians are doing just that. Nearly 41,000 alone yesterday in Victorian government hubs. I'll now ask the Acting Chief Health Officer to make some comments, then Jerome will do the same, and then we will try and move through questions as quickly as possible.
Thank you, Premier. So following on, with regard to vaccinations, we saw a good turnout again in the construction blitz yesterday. Just a reminder that the deadline for first dose construction vaccinations is midnight tonight, and this is now more significant to construction in regional Victoria, which remains operating in areas that are not under lockdown. But it's a very good reminder also for Melbourne construction workers to use this 2-week pause in order to go and get vaccinated. I wanted to talk about a few other vaccination successes. More than 23% of 12 to 15-year-olds have now received their first dose since they became eligible only last Monday. We now have 80% of Victorians over the age of 40 having received their first dose of vaccine. And this week, we've actually had more than 400 Moderna doses administered in pharmacies across Victoria. If you're under the age of 60 and you haven't yet had your first dose of vaccine, this is a really good option for you to start your vaccination journey. So I encourage you to go to findapharmacy.com.au to see if you can book in to get a Moderna dose. And we're looking forward to see that number rise dramatically. In terms of testing, The Chadston drive-through on Golfers Drive has been closed because it requires an engineering assessment following yesterday's earthquake, and we're therefore diverting people to the Monash University Clayton drive-through. And now just a message about the long weekend. So tomorrow is obviously the first public holiday and long weekend that we've had in 3 months. And unfortunately, it's not the time for home visits or group gatherings. And if we want to make sure that our next public holiday may afford us some of those opportunities, it is incredibly important, and I know it's tough, to make sure that you don't use this weekend to visit friends, to visit your cousin, to visit your parents. In terms of catching COVID, that would be one of the most dangerous things that could be done this long weekend. So instead, we urge people to use the day off to go and get vaccinated. Thanks very much. I'll now hand over to Jerome.
Great, thanks Devon, good morning. In terms of 766 cases, that of course is the highest number of COVID cases we've seen in Victoria since the very start of this pandemic, and it's a very challenging number for all of us, and again redoubles our focus on doing everything we all can as a community to slow down the rate of community transmission over the days and weeks ahead. Over half of those cases, 55%, are occurring within known households, people where there are already a known positive case, and as we've said now a number of times, when COVID comes into individual households, the attack rate is very high and the risk to other members of your family is very high indeed. It's very likely that everybody in the household will contract COVID at some point over that duration. In terms of the distribution, it's a very similar pattern. In our northern suburbs, we have 468 cases. That's over 60% of all of today's cases. I'll particularly call out the local government area of Hume, where we have 264 cases in yesterday's numbers. That's a 60% increase in the last 4 days, and we're doing a lot of work with the local community in Hume to see what we can do to support them to reduce that rate of onward transmission. Particular suburbs of concern include Craigieburn, Roxburgh Park and Meadow Heights. In our western suburbs, we have 172 cases, around 22% of today's total, in key suburbs such as Hoppers Crossing, Point Cook and Werribee. We're continuing to see cases in our southeastern suburbs, so 10% of today's cases, 76 cases in the southeast, across Pakenham, Dandenong and Berwick. And finally, a relatively small number of cases in the east, 24 cases in the east, in Doncaster East and in Croydon. We also have 2 cases that are acquired interstate in today's numbers and 3 cases that remain under investigation. In terms of regional Victoria, obviously a good day yesterday with last night with easing off the restrictions in Ballarat, and my thanks to the whole community across Ballarat for their support work over the last 7 days. Of the 21 cases in regional Victoria, we have 1 case in Ballarat, which is a known household primary close contact that's been isolating for the entirety of their infectious period. We also have 8 cases in Mitchellshire. 6 of those are linked to known cases in 3 different households, and their isolation protocols are reasonably strong. We also have 1 truck driver based in Mitchellshire who was picked up in that routine surveillance testing we introduced a number of months ago. And again, it highlights the importance of that routine asymptomatic testing and picking up those really important cases. We have 1 more case in Mitchellshire that's under investigation, came in very late last night. In Bacchus Marsh, Moorabool area, we have 4 new cases, all linked to exposure sites and workplaces in Metro Melbourne. In the Macedon Ranges, we have 5 new cases. 4 of those are known close contacts of an existing case we've been dealing with over the last couple of days, and 1 is known to a separate workplace exposure. In Mildura, we have 1 case which is a known household contact of the positive case we discussed a number of weeks ago now, so we're still seeing onward household transmission in that family, but otherwise isolating and otherwise well. We have 1 new case in Surf Coast Shire, again a known primary close contact. And finally, we have 1 case under investigation in Bendigo, and we'll update the details of that case in our show release later on this afternoon. 3 particular locations of interest just to call out. 1 is the Meadow Heights aged care facility we've been discussing over recent days. 1 more case amongst a resident. That's now 22 cases in total in that aged care facility across 18 residents and 4 staff. As like we said before, a very high vaccination rates amongst the staff. 94% of those staff are vaccinated. 77% of the residents are vaccinated, and we have moved 11 residents into a hospital setting to provide effective care for them, both with COVID and other underlying conditions. And as the Premier says, that gives some account for the increase in the number of vaccinated people currently in the hospital setting. We also have a wholesale food and supermarket site in Somerton, where we now have 18 cases. That's an increase of 3 from yesterday. One of the quite few supermarket type exposures we've seen in recent days. And again, please encourage anybody who's been in and around the Somerton area, if you've been to those wholesale food and supermarkets, please come forward and get tested. The Fitzroy Community School is now going through its day 13 testing. We have a total of 60 active cases continuing with that school, and of course keen to see the rest of the school community test to complete their day 13 isolation. And as part of that, of course, we continue our ongoing work with our primary close contacts. In total, 38,000 primary and secondary close contacts. Another 2,500 were cleared yesterday. And even in these days of high COVID case numbers, continues to be exceptionally important that people maintain with their isolation protocols. And we, of course, continue to contact people when their positive case results come through and work with them to identify their primary close contacts. In terms of testing, a record day in testing yesterday, over 62,000 cases, and my thanks to the entire testing teams for the phenomenal work they're doing all across the state. We're now seeing across the state as a whole, for every 100,000 people, we're doing about 11,000 tests over a 2-week period. It's a pretty high percentage. So 11% of people are getting tested over a 2-week period across the metro area. That rate drops to about 7.8% for regional Victoria. But I use that benchmark to also highlight we're seeing very strong and welcome demand for testing in Hume and in Moreland and in Whittlesea in particular. So we're getting great support from the community to come out and get tested in high numbers. We know those are the really active COVID areas, and obviously we're very keen to track down all the community transmission that's happening in those LGAs and in those communities. So in Hume, we're seeing 23.6% of people getting tested over a 2-week period. In Moreland, 20%, and in Whittlesea, 17%. And happy to brief in the CHO release a bit more detail on that work programme. Finally, in terms of vaccination, we've seen really strong increases in vaccination uptake, particularly in our western and northern suburbs and in our southeastern suburbs, as we've started to focus our doses towards those LGAs of concern, of priority. We now have 76% first dose vaccination in Wyndham. In Hobson's Bay, we're at 74% first dose vaccination. In Cardinia, and we are at 72% first dose vaccination. In Casey, 71%. In Dandenong, 67%. And finally in Hume, 67%, and Whittlesea, 65%. So still more work to do, particularly in Hume, Whittlesea and Dandenong, but all those LGAs I've just called out have seen significant increases in their first dose allocation, and every single dose we're putting into those LGAs is being taken up at record speed. Finally, we continue to run multiple community pop-ups in those LGAs of concern in particular, as well as our 55 state clinics that are open all across the state, including at the Australian Islamic Centre in Newport, where we've now completed over 6,500 vaccinations over the last few days. At the Broadmeadows Community Hub, where we've completed over 1,700 vaccinations over the last few days. At Springvale Town Hall, that opened yesterday and was booked out by lunchtime. And at the Palm Plaza in Dandenong, where we did over 850 vaccinations yesterday. And finally, the Hazel Glen School in Doreen, where we're vaccinating around 400 people a day. All just examples of the kind of in-reach of vaccination we're doing across our most important and vulnerable communities. With that, I'll hand back to the Premier for questions.
Thank you, Deb and Jerome. Happy to take any questions you have.
What's the logic behind allowing people who are fully vaccinated, have tested negative, to still have to quarantine at home for 2 weeks, given case numbers in Victoria and New South Wales are approaching, I guess, parity?
Well, they're not quite the same. They're not quite the same. There's approaching 50,000 active cases, or total cases, in New South Wales. So the epidemics, the pandemics the outbreaks are in very different positions. The requirement to test and to be fully vaccinated is the Chief Health Officer's advice, and as I've said to you on so many occasions, it is in all of our interests to follow the advice on this. We want people home, but we've got to take every precaution to not have them bringing the virus with them. These precautions are not only the advice of the Chief Health Officer, but if you think about it, there are some countries in the world where there's less virus than what there is in the state of New South Wales. And I take your point, with the growth in numbers in our state, we may get to that point also. So this is the advice. And I think, to be honest, I think if people are given the opportunity to quarantine at home, that they'll come home and they'll be very pleased to be home, and I'll be pleased to have them home, because we don't want people locked out of their own state.
Are you comfortable with that 2 weeks, rather than maybe at the orange zone protocols, which is test negative once you return?
Well, they're not coming from an orange zone. They're coming from an extreme zone, not even a red zone. They're coming, yes, but as effective as the double vax is against you or me, if we're double vaxxed, becoming seriously ill, it does not prevent you from getting the virus, and it doesn't prevent you from spreading the virus. And that's the last thing we want to do, because every case, that's why these numbers, you know, they will bounce around a bit. We don't know what tomorrow's number will be. We'll have to wait and see. It's a good test number, but it's a very high case number compared to what it has been. It had been relatively stable for the last 4 or 5 days. The way to look at those numbers is that about 10% of those people will finish up in hospital. So that's why we don't want to be inviting the virus in. We have to take every precaution to keep it out. But it is proportionate to allow those people to come home under these rules. And I'm sure that there might be different views, but I'm sure they'll be very pleased to come home, and I'll be pleased to have them back, because I don't want people locked out of their own state.
Does someone who's fully vaxxed and has tested negative pose more risk to the Victorian community than someone who's moving around the Victorian community, any normal person, when we've got 766 cases a day?
Well, I think you probably need to look at the vaccination status of the normal person, as you put it, and we're not letting people just move around the community, Rachel. There's a lockdown on, so we are.
Sure, but
we are limiting movement. We are absolutely limiting movement. Sorry?
The rest of Victoria is not doing 2 weeks home quarantine, though.
No, they're not, because they're not living in an extreme zone, and Melbourne is not yet in an extreme zone. It is. We've got significant community transmission, but I don't think it's a fair comparison to say that Sydney and Melbourne are at exactly the same place. We aren't. We hope we don't get to where they've been. It's not a sense of criticism, it's just the way Delta works. Hopefully we can get people vaccinated, we can start to see that plateau and then fall. But look, the Chief Health Officer's provided advice to get people home. There are rules, there are things you have to do, because we're in a global pandemic.
Well,
and
it's taken more than 3 months to give these people a means of coming home.
Well, I'm here to make these announcements today. The situation is very different today than what it was 3 months ago, but it's not so different, Rachel, that we can just say, yep, come back, no rules, do whatever you want. That's not how it works. And just as there are rules for people coming back from regional New South Wales, who are in now red zones, orange, hopefully, but certainly red, no longer extreme. This is also a pathway home, very clear one, very obvious one, for people who are coming from Sydney. And yes, there are rules attached to that.
When you announced that we would...
Victorians will be eligible for this that are waiting to come home?
I think it'll be several thousand, Chanel. I can't be absolutely clear, because not everybody has registered or applied to come home, but we think it's thousands of people. And look, we're just happy to be able to have a safe way for them to return. And if that had been able to be achieved a month ago or 2 months ago, then that would have been terrific. But you know, this is a pandemic, and you can only do what's safe, and you can only do what you can get solid, defendable advice to do. And that's exactly what we're doing today.
If you're stuck in New South Wales and you're a Victorian, can you just go to a state hub there and get vaccinated and then come back once you've done your double vax?
You'd need to get yourself vaccinated either at a GP clinic, at a pharmacy. For instance, Moderna's not just available at Victorian community pharmacies, they're available in New South Wales community pharmacies. Or you might be able to, I'm not expert on the state hubs as they're operating in New South Wales, but I'm sure there are options that you could avail yourself of. There's a lot of vaccination going on in New South Wales, arguably more than any other place, because they've received more vaccine than any other place. So I don't think people will have. Well, I'm not aware that people should anticipate having trouble getting vaccinated. But if that were an issue and it was raised, then of course we would look at that.
Many jurisdictions around the world are moving to 5 or 7 or 10 days quarantine.
Yep.
Do you see a situation maybe quite soon where we could bring the 14 down, and then just separately?
Potential.
quite soon, do you think?
Well, no, there's a trial going on in New South Wales at the moment, actually, that was announced just ahead of National Cabinet meeting last Friday, where I think that carries the support of the Chief Medical Officer of the Commonwealth, Professor Kelly, to run home quarantine for 7 days for a particular group. We'll look with that. We'll look at that closely. I think every state and territory will look at that closely, and the Commonwealth too. The whole world changes once we get to 80%. And if we can go even beyond 80%, well then all the better. And that means that borders can open between states, borders can open to the rest of the world in stages, and double vax people, they're going to get given preferential treatment in travel within our country, international travel, going to the pub, going to the footy, going to the cricket, all of those things. There's going to be preferential treatment, as there should be, for double vaccinated people. So that'll also involve, I think, a different quarantine arrangement. I don't think we will use hotel quarantine quite the way we have. There'll be different cohorts. For instance, not everybody who's double vaccinated, Paul, is vaccinated with a vaccine that is recognised. So that's where Mickleham and maybe other facilities as well, and indeed some hotels may well be a feature of 2022 and beyond.
Any discussion in the cabinet about using the technological solution for the returnees from Sydney?
Yes, there would have been. Not so much discussion in the cabinet. I don't think there was discussion.
Why did you decide against it? Is my question.
Sorry?
Why did you decide not to do that?
No, it's not a matter of deciding against it. The public health advice and the advice of the health department is that we don't need to go to that level. We'll find other groups where we think it's more meaningful and where it'll perhaps play a greater role in mitigating risk. So if the advice is you don't need to do it, then we'll find others to. We already have done some trials. We'll find, and it's worked well, is the briefing I've had. But we'll find other groups to do some trials on, and it may well be, for instance, overseas groups, whether it might be, say, students next year or people who've come as seasonal workers, for instance, from a Pacific island that is orange, but we kind of think it's green. Probably if they had a higher testing rate, if they had our testing rate, for instance, that might be some of the places where we can test some of that tech.
How are we travelling trying to get more Pfizer vaccines into Victoria to try and get that dose interval down and maybe hit 80%?
Well, I can't. That is not an option to us at the moment. I would love to be able to bring the dose interval down. I'd have to get advice. It's not politicians who make that decision. It's a team of doctors do. But that's not an option that's available to us at the moment. I simply do not have the stock in the fridge or the freezer to be able to bring that dose interval forward. It's not on the table. It is not an option. Look, we are currently rationing Pfizer. We are currently pushing as much AstraZeneca as we can. And our friends in community pharmacy are pushing the new Moderna vaccine, and we're grateful to them. But I have to ration Pfizer because I don't have enough. I do not have enough, nowhere near enough, to be able of Pfizer to be able to change the dose interval of Pfizer from, bring it down to 3 weeks, say, which would mean more people were double vaxxed quicker. But I just don't. I don't have the supply, and I can't just dream it up. Now I know there's, you may get told something different out of the Commonwealth, but I'm telling you, we don't have it in the fridge or the freezer.
Are they reluctant to give it to Victoria?
Well, we don't have it. You want to talk about the people who can answer when it might come and in what circumstances it might come? That's the Commonwealth government, but we don't have it. I am currently have no choice but to ration this, and even if I got advice from the experts to reduce the dose interval, I don't have the stock.
Premier, on Sunday you flagged that there was a potential issue with supply later in October.
Yes.
Has that been fixed? Is that been clarified? Or is that what the point you're making with Simon?
No. I'm making a point that I'm not getting into a debate because this is. I'm not getting into Rich. I'm not getting into a debate about what's caused the fact that I don't have enough supply to bring the dose interval forward. I'm just stating a fact. There is not enough supply in Victoria of Pfizer to change the dose interval, the time between first and second dose. This is a race to get people second dose vaccinated, and I can't speed up because I don't have the stock. What's caused that? You've got to speak to the Commonwealth about that. But we were told by no one less than the General himself at National Cabinet that there was problems with October. Now you've all been told that that's wrong. Well, I don't know. I can't be here to try and interpret what the Commonwealth Government says to you, but I know what I was told at National Cabinet on Friday, and I'd encourage you to go back to the Commonwealth Government and perhaps ask them some of these questions.
Why haven't we pushed harder with the Commonwealth government to have more supply allocated. When New South Wales put their hand up in their initial part of their disastrous outbreak, they were asking for more supply. So why haven't we done the same?
With the greatest of respect, I don't think it's a fair criticism to say that we've not pushed back and pushed quite hard on the Commonwealth.
We've got a shortage of supply now. So.
And that's my fault, is it? Like, seriously, we have made the point consistently. If I'm to be criticised for the fact that the Commonwealth Government didn't order it at the right time or get enough supply or provide it to me now, we can have the most robust exchanges you want, but let's be very clear. I don't think it's fair to blame the state government for the amount of vaccine we've got when the vaccines are not ordered by us. They're not ordered by us. No, I think you are being critical of the state government. And you're entitled to do that, and I'm also entitled to say I don't know that that's fair. If you want to talk about supply, and have a chat to Minister Hunt or somebody else in the federal government. And they're the ones who do the ordering, they're the ones who pay for it, they're the ones who ship it in, they're the ones who distribute it around the country. We're not doing that. We're doing a lot more than we said we would do, and we're proud to do it. 50% of the overall program when we said we'd do 25. But I tell you, I don't think it's unreasonable for me to push back and say no. I'm not going to stand here and be criticised for supply. I'm not responsible for supply. I'm not. So have a chat to the feds.
Can I ask you about case numbers? So we've reached a higher case number today than we did at any time last year.
Yes.
When you said that a couple of weeks ago that we're not trying to achieve COVID zero, you did say that we need to try and keep a lid on
Correct.
case numbers.
Yes.
So where is that lid at the moment? And I guess what's the modelling telling you that where the peak will be?
Well, the modelling remains unchanged from that which we provided to you from the Burnett last weekend. And there is a range. There's a lower range that's more on the kind of positive and optimistic side, and then there's a higher number that clearly is a much bigger challenge for us. All of us, we've been very clear, numbers would go up, and they are. That's not something to be celebrating, though. That's something for us all to work as hard as we can to try and defy that trend or try and shape that trend. They're going to go up, but we can, all of us, in the choices we make, limit the amount by which they go up. We're not going to be able to drive these cases down to zero. We were clear about that. That was the health advice. That was a legitimate and reachable goal for a long time, but then it spread so far and so wide that it becomes impossible. What is possible, though, I say this to all of you and through you to all Victorians, it is possible for us to have less cases rather than more. We can, each of us, prevent transmission of this virus. And every transmission that doesn't occur is one less person who may find themselves in hospital, one less person that a nurse has to provide care for, one less person that potentially becomes very seriously ill. So we can't encourage cases. That's the point around, yes, there are rules on people coming back from Sydney, and I wish there weren't. I wish they could just freely travel back here. But I can't do anything, so I certainly can't ditch health advice to do what's more convenient when that might in fact mean there's more virus here. It's all ones and twos, Simon. It all adds up to a much bigger picture. And what we know is that if there are 10 cases of this virus, chances are one of them is going to finish up in hospital.
Is there something we can do with our testing numbers, perhaps? I mean, I know we're sitting on about an average of 60,000 tests, and New South Wales are averaging over 100,000. So can we ramp up our testing supply to ensure?
I would make the point. One, New South Wales is bigger than us, right? They're a bigger state than us. Two, they have required a number of people in certain settings and in certain geographical areas to get tested. So there's a whole bunch of asymptomatic mandatory testing that I understand it contributes to that number. But it's not a testing contest. We believe that we are testing enough people in a broad enough range of settings and contexts that we're getting, you never get a complete picture, because there's always some people who don't test, but we believe that the testing is robust and the testing is helping us to find those cases that you can reasonably expect to find, is the point that I'm making. Obviously, those test numbers can go up if there's more symptoms in the community, if there's more virus in the community, if there's more people who act on their symptoms and go and get tested, well, that'll be good. Be very good. But we're not unhappy with these test numbers, and we're very grateful to those who've come forward and got tested.
You spoke about drama yesterday at the Town Hall vaccination site. They've just tweeted that they've had to close today.
Yeah, they have, and that's very regrettable. They're providing vaccines to some of the most vulnerable in our community, people who, despite their age, may not be necessarily in great health. Some of those who are least fortunate, least powerful, least influential in the Victorian community, people who are sometimes not much thought is given to them. But with our partners, we were doing really important work down there, and those staff who were doing that work have been treated appallingly, and that's just not fair. It's not right.
We've had day after day of this action now. Is what they're doing out there making you rethink mandatory vaccines in any way, shape or form?
No, that decision's been made. And I would just note, the same decision was made in New South Wales. So, you know, this is happening in many different parts of the country for the same reasons. And I just say to people, violence doesn't work, only vaccination works against this. Go and get vaccinated. There is no alternative. And the good news is, and let's not have the ugly actions of a small number detracting from the amazing work that the vast majority of people across the state are doing, following the rules, making huge sacrifices. We're so close. We're so close to getting to that 80% single dose, the 70% double dose, and then 80% double dose, delivering the roadmap, a roadmap that delivers the national plan agreed to by all political leaders from all political parties across our nation, getting the place open. That's what I'm passionate and committed to doing.
Is everyone within
None of us should do anything to put that at risk, is what I'm saying.
Is everyone within the government on the same page on this as well, though? Because it sounds like you may have lost quite a senior advisor over this particular...
No, I don't think that's an accurate description at all.
What was the scenario?
I'm not here to talk about the circumstances in which the individual that you referenced left the government, but to indicate that the person left in protest is completely wrong. Completely wrong.
What was wrong about it?
It's not factual, Paul. It's completely wrong.
What is factual about his leave?
No, I'm not, as I just said, I'm not here to have a discussion about the circumstances in which an individual left the role that he had. What I'm putting to you, and what I'm perfectly entitled to put to you, is that what's been reported is wrong.
You are perfectly entitled to say it's wrong, but
I am.
surely if you say that, you must
No.
put forward what you believe to be true.
No, I don't believe so. I'm not having a debate with the bloke. What has been printed is wrong. Did not leave in protest. That's wrong.
Premier, today,
And I'm putting it to you more directly than I think that perhaps it was put to us. What's been printed is wrong. That's my line. That's my line to you, because it happens to be the truth.
Premier, today was officially...
Sorry?
Has that person left?
Yeah. Well, it's not there's no question about whether the person's left. It's a question about the circumstances in which they left. And I'm making it very clear to you that what's been put out there is not factual.
Can you clarify then? Because it's a significant...
No, it's not actually. It isn't. The person's gone. And the notion that they left in disgust or protest is just wrong.
Can you clarify that to allude...
No. No. You might want to have a look at when their contract was ending. You might want to have a look at when their contract was ending.
Did you speak to him or anyone else at Partner?
I don't believe I've ever spoken to him.
Have you spoken to anyone aware of the circumstances of his departure to inform your view?
My view is well informed. I'm not of a habit. Paul, I'm not in the habit of getting up here and just making things up. So, my position is that what's been reported is not accurate.
And you're not willing to say why you think that's the case?
No, because I'm not willing to enter into a debate and a discussion about what are essentially matters of an individual who's readily identifiable. What's been put out there is simply wrong.
You don't think it would be good to clear it up, though, if that is incorrect?
Well, from my point of view, I have.
You haven't provided a reason as to
No,
why
it's
you
not.
left, though.
I'm not here to talk about the individual employment arrangements of an advisor. The only reason we're having this discussion is something that is factually incorrect was put into the public debate. You asked me the question. I didn't raise it, and I've got no interest in speaking about it in any more detailed terms. I'm simply saying what's been put out there is wrong, and I've answered the question, and I don't intend to keep going round and round in circles. I've made my position very clear. What's been put to you and what's been printed is not correct.
You said the contract, his contract was up, but he wasn't offered another contract. Is that right?
Well, clearly.
His
Why
term
wasn't
may
he
have
offered-
been...
Why wasn't he offered another contract?
Well, again, I'm not. It's a very clever question, and then I'm into a discussion about his merits and otherwise. I'm not having a debate with him or with you about him. It's been put to me that he left under certain circumstances. It's been printed that that's what occurred. That's not accurate. That's the advice I have, and that, as far as I'm concerned, that's the end of the matter. And I don't think it's fair, frankly, to be having a great long debate about that person and all the reasons the government may or may not have extended his contract. I don't think that's particularly fair. And I don't think it actually achieves anything. But when something is printed that's wrong, I'm perfectly entitled to make that point.
Vaccination becomes mandatory for construction workers from tonight.
Yes.
It doesn't actually become mandatory for health workers until the 15th of October. even though they've had since February to get vaccinated. Some younger construction workers have only had a couple of weeks.
Yep.
What's the reason for that?
Well, there are different timelines. If you remember, way back quite some time ago, aged care workers were made mandatory, and there was quite a lengthy period of time, quite a lengthy notice period. I think that there is a degree of urgency when it comes to the construction sector because of the number of cases that we've seen. Now, that's to a certain extent superseded by events in metropolitan Melbourne because the industry has closed. But let me be clear, they are deadlines that are really important. We want people to go and get vaccinated as fast as they can, and we'll monitor that closely, and then we'll make the relevant decisions about reopening, and I hopefully we have seen a very significant number of people who've gone and got that first dose.
Who poses more danger of a construction, if you're comparing a construction worker on a construction site to a hospital worker in a hospital, who poses more danger if those people are both unvaccinated?
Well, interesting though, Rachel, if you just looked at case numbers, then it's not where I think you're headed, which is the hospital worker, because there are more cases of coronavirus in construction than there are in hospitals.
There are a lot more vulnerable people in
Yeah, of course
hospitals than there are on construction sites, I would have thought.
Yes, but look, again, you have different risks in different settings, and the notion that unless everybody has equal risk, only the highest risk cohort should go and get the jab. Like, this virus presents a risk to everybody, but the risks are different. The risks are different between you and I, for instance, based on health status, age, all sorts of issues, right? So just because you have lower risk than somebody else doesn't mean that you should be voluntary vaccine. You should be voluntary vaccine. They should be mandatory. Like, it's a case by case basis, and there is a very clear risk of transmission and significant cases being driven by unvaccinated people in the construction sector, particularly when that's an industry that's open when every other industry is not open. So I'm not making comparisons between nurses and teachers and construction workers. They all have different risks, but they all need to be vaccinated as a matter of mandate to mitigate those risks.
You have effectively prioritised vaccinating construction workers over vaccinating health workers, though, in terms of the dates at which.
Well, no, that's not right. But hang on. Let's just think about this for a moment. Healthcare workers have been prioritised for months and months and months, right from the beginning of the Commonwealth's vaccination program. So they've been eligible. They, I think, right now will be at a much higher rate of single and double dose. The mandatory nature of it is, if you like, that last, whatever it is, 5% or 10% of people who, for whatever reason, may not have been prompted to go and get the jab. In public sector aged care, a month or more ago, we were in the very high 80s or even the low 90s, I think. And anybody who had not been vaccinated was not rostered on to work in public sector aged care. I don't think the construction sector is in the low 90s or the high 80s. I think they've got a way to go. And that's not a criticism. Many of those people are younger, and they were not part of 1A and 1B. Remember all those right before the Operation COVID Shield, all those priority groups? They weren't part of that priority group. What's more, the other point you might make, well, you're prioritising with the dates and with the mandate and everything, you're prioritising tradesmen and women or construction workers over retail workers or over hospo workers. Yeah, because construction's open, or at least it was until we had to unfortunately reset it. It'll be open again, hopefully, toward the end of next week. That's what we're all aiming to.
Just with the construction, are you prepared to let some sites show they've got high vaccinations, or even if they've got enough to operate at a minimum, will you allow them to reopen earlier if they can demonstrate that they have a vaccinated workforce?
I'm not here to make announcements about when that industry will reopen. I hope that it can be simply a 2-week reset. Obviously, the more people that get vaccinated and the faster they get vaccinated, the more options we'll have. And when the Chief Health Officer provides advice about what's safe, and when we sit down with big employers and industry associations and unions, we'll be able to come up with a package to reopen the industry. That's what I'm absolutely keen to do. The whole industry was closed because it was felt, I think I went to this yesterday, it was felt that you might well see some of that ugly behaviour that we've witnessed at individual sites. If some sites were allowed to be open while others were forcibly shut. That would not be a good thing for anybody. So.
And do we still have an update on how many in this sector have been vaccinated? I know you've been asked previously.
No, I was asked yesterday, and I haven't.
Because I know that we know that, 60% of 25 to 45-year-olds have their first dose of vaccine, so it would indicate that half, I mean, you look at 300,000 in the sector, 180 then potentially could be vaccinated, so we might have a higher uptake of those that have been already
We
vaccinated.
may do, and when I've got information for you to clarify that, like this is not a simple matter. We don't necessarily have a record of everybody who was vaccinated prior to these decisions, so there would have been a goodly number of people who perhaps were vaccinated earlier. We'll get you the update as best we can. I don't have numbers, nor does the Deputy Chief Health Officer, Acting Chief Health Officer, have numbers today, as she indicated, I think, in her opening comments. But as soon as we can get you a number, we'll certainly try to do that.
There's no mechanism to monitor. There's no one actually knows the number of construction workers who have been vaccinated, and there are no real estimates. It's all been anecdotal. So on what basis can you make the claim that it is lower than the average, or likely to be lower than the average of that age bracket? How do you know
I'm not sure that I am making that claim, Paul. But at the moment, you've got to work your way, like just as a process of logic. And please don't. I don't know that I am making that claim. What we're saying, the Chief Health Officer has determined that the safest building site is a building site where everybody's been vaccinated. That's the decision, right? So those who are coming on that site are people that can establish that they've been vaccinated. That's the decision that's been made. Now, I don't think it's such a big leap of logic to say that clearly not everybody in construction has had 2 jabs. No, perhaps sector in the community really at 100% has had 2 doses. So that's what we have to work towards, and that's what the Chief Health Officer has determined. I think just as, again, a process of logic, we're not talking about people in their, by and large, in their 80s and 90s. We're talking about people who are often much younger. They've only become eligible recently, so it's not a point of criticism. I don't think it's unreasonable to assume that that industry will be below the 75% single dose and the 45% double dose because they're younger.
If we're not tracking it though, when you go...
No, I'm not saying we're not. I don't have a number for you right now. We are trying to get a number for you, but again, I don't have access to people who go to their GP. I don't have access to people who go to their pharmacy necessarily.
Is your actual occupation recorded though when you go and get your
Well,
vaccination?
but recorded by who?
By the government.
Yeah, well, not the state government. Not in GP clinics, it's not.
No, in the mass vax hubs though, where you're
Yeah, and that's that's only part of it. I'm being asked about the whole industry, and as soon as we can get you some information, I'm not saying that we won't get it, but I don't have it in front of me now. When we do, we'll be happy to report progress.
Is it possible though to get it until those sites are reopened and bosses are physically checking off vaccine passports or proof from their workers as they file back into a site?
Again, if the intention of your question is this going to delay us in getting open again? I don't think it will. I think that we will have reset this toward the end of next week, which will be the 2 weeks. Early the following week. That's what we're working towards. Again, no, the construction was closed to zero, like right down to nothing in New South Wales, in Sydney, for the same sorts of reasons. And if you get health advice to make it, it's a big step. I'm not pleased to do it. We want to get it open again. Getting vaccinated is an important part of that. And then, wearing your hard hat, your high vis and your mask is incredibly important. Taking COVID risk and COVID safety as seriously as I know people on building sites large and small take other issues of safety. There's a great culture around safety across this industry. We just have to make sure it's not just the stuff you can see, it's also this virus.
Premier, it's 2 sleeps to the grand final. Just a couple of questions on that.
I'm sure our audience has noted that you're counting things out in those terms, Rich. That's very good.
Some people who are in singles...
For those who get some sleep, yes, it will be 2 sleeps, Rich.
People who are in singles bubbles, it's a night grand final. Will there be any concession for them to watch the footy with their person in their singles bubble?
Vis-a-vis the curfew, you mean? Or?
Yes, given it's a night grand final.
Not that I can announce today. There's been no decision to that effect, but I'm happy to raise the matter with the Chief Health Officer and see whether his thinking has changed. If it has, I've not been made aware of that.
And also, just in regards to some of those border communities right on the river, they've got a situation where in towns like Echuca, the pubs can only have 20 people for the grand final, but just over the river they can have many hundreds. Is there any way that the border rules need to be consistent for those border communities?
Well, we've tried to make the rules as consistent as possible, but I'd also make another pretty obvious point as well. Like, people will be at the pub in Wodonga, and I don't know that they necessarily will be at the pub in Albury, because Albury's under a lockdown. So you can have different situations. Hopefully they come out tonight. I think Albury's due to come out tonight. Hopefully they... Oh, did they indeed?
They did.
Effective when, Rachel? Was it from midnight tonight or something?
Midnight last night is my understanding.
Well, good on them. I'll slightly...
A question about that once
That's
it's
terrific. I'll
through.
slightly adjust my analogy then. There was no one having a beer yesterday or the day before in Albury at a pub. There might have been some in Wodonga. So the point I'm making is things can be different on different sides of a border. The settings in New South Wales, best person for you to have a chat to there would be Kerry Chant, because she's the Chief Health Officer in New South Wales.
Just on Victoria's restrictions on Albury, are there plans now that they're out of lockdown to downgrade them from extreme risk zone to red?
I would think so, yes. If that's not already occurred, then it would occur quite soon, I think. We know that community in so many ways kind of operates as one, so it's been a very difficult couple of years. I'm sure it's been even more difficult with Albury lockdown and Wodonga open, albeit under some heavy restrictions. But that will have just added to some of the complexity that people on the border are often frustrated about. I know I'm quite familiar with that dynamic.
Premier, what was your reaction when you saw the protesters go to the shrine yesterday?
Look, it's a disgusting thing. It's a sacred place. It's a place where we honour the sacrifice of those who gave so much, and it's just not appropriate to be there. It's just not. It should be there for silent reflection and for an honouring of those who gave everything for us, not violent protests.
These protesters are
I think
now
the CEO of the Shrine put it very well, that for the veteran community, for serving men and women, for fair-minded people across the state, it's very jarring, it's very confronting, and it's deeply offensive to in any way disrespect that sacred place.
Premier, these protesters are now encouraging nurses and teachers to join the fight against this mandatory vaccine imposed on this sector. What do you make of this?
Well, people can encourage all they like. My experience, and I've met many thousands of nurses in my time in public life. They're there to care for people, and they're there to administer vaccines, be vaccinated themselves, do everything they can to keep people safe. That's my experience.
Do you think we'll see more retaliation from industries as this develops at all?
I certainly hope not, because the case is very compelling. Vaccination is the key, not violence, not protest. Vaccination, getting vaccinated, that's what gets us to the other side of this. And you know, some of the stuff we've seen has just been ugly, unlawful. But the other thing too is it's, you know, it just doesn't make any sense. We're so close. We're so close to being past this, and it will be very difficult when we move past and open up and normalise this. But we are within reach, and we've just got to find a way, all of us, to see this thing off.
Just quickly on the numbers, with our projections in the roadmap for second doses, are we still on track to meet that October 26 and November 5?
We're doing our very best. But supply issues and any sense of frustration that I might have about supply, and which I may have given you some insight into today, it comes from a sense of frustration that if we don't have supply, then we won't hit our targets. And all of you every day ask me about targets, and I know why, because it's important to your readers and your viewers and your listeners, and it's important to me. I want to get to these targets as fast as we can. That's why if the fridges are empty, you have less options than if they're full. And I don't need unlimited supply. I just need more than I've got, which is not enough to say bring the dosage interval forward. That's just a statement of fact. I'm not interested in having a debate with the Commonwealth Government or doing anything other than pointing out the facts. People are entitled to know, because it is something I think people are thinking about. Oh, why don't we just bring the second dose forward? It's a logical thing. Well, yes, it is. But it's not an option I can do at the moment. It's not something I can do at the moment, because I don't have enough Pfizer to do it. Not now, and not into October. Now you can say, oh, well, why don't you just take some second doses? Well, that's dangerous. That's because I don't know that they're going to be replaced. The last thing I want to do, you know, like as in take allocations that are out in the future and maybe have less first dose appointments and stuff. I don't want to do that. That is not a smart thing to do.
And with regards,
The retired nurses were given the call up.
Yep.
Is that happening now? There's some.
I understand so. There's some announcements I know have been made in Sydney today, I think, about a whole lot of different people who used to be in the health system and trying to call them back. We'll have a look at that. I think we're doing some of that ourselves. And not just to play clinical roles, there's other things they can do. For instance, everything from assisting with contact tracing or state vax hubs and things like that, all the way through to maybe coming back and doing some shifts, probably not in intensive care, maybe in other parts of the health system to kind of free up other people. We're doing some of that. There's a lot of planning. But I saw those reports this morning, and I had a feeling you might ask me. I haven't had a chance to ask the Secretary of the Health Department yet or the Minister, but I'm sure they're looking at that.
Is that something you can find out how many we need?
Sure, I'm more than happy to try and come back to you. Well, I think what I'm saying is I think we're doing a bit of that now. If there's more I can add, then absolutely we will.
And is there an update on what's happening with Geelong?
Geelong is looking better. I don't have an announcement today, but I think it's progressing as we had hoped. And again, it's all dependent on what happens, in these next couple of days. But we hope to be able to have positive announcements for Geelong soon.
Just back to Chanel's point, do you have confidence that our hospital system's holding up right now?
Not only a matter of confidence, I'm certain that there's stress in the health system. Some might say that was any day, COVID or non-COVID. It is it's a busy environment. I think we're holding up at the moment, but I don't underestimate the challenge it is to nurse COVID patients. I don't underestimate how hard our staff are working now. And we're going to ask a lot of them in the coming weeks and months, because in order to normalise this, in order to get open and get past this virus and not be in this perpetual state of trying to suppress it and be locked down forever, then there are going to be a whole lot of unvaccinated people who get very, very sick, and they're going to have to be cared for. So the key point is, don't be one of them. Get vaccinated. Don't be someone who's unvaccinated and finds themselves in hospital, or contributes to somebody else being in hospital who can't get vaccinated, for instance, for medical reasons. These numbers are solid. They're growing steadily. They could grow faster, I think, if we had some more supply. The sort of supply wars stuff, I'm not interested in having the debate and discussion, really. I just want the stuff. But I was asked a question and I answered it. And I can't bring the dose interval forward because I don't have supply.
Do you already know how many of today's cases were vaccinated?
No, but if we can try and provide you with a sense of that in the CHO release, I'm happy to try and do that.
And given it's a record day, a year ago that would have been the focus for everyone, that's the number we'd be talking about today.
Yeah.
Obviously there's a shift in how we look at these things now, but for those that are sitting at home and think, my goodness, 766 is a frightening number, what is your modelling showing we're going to get to? How far are we off a peak?
I think we're going to take, like every day this week, for instance, Burnett's been programming in, taking the actual numbers and replacing some of their assumptions. Today will be, important, just as tomorrow will be. We'll do some modelling updates at various points, but it had been stabilising a little bit for the last 4 or 5 days. Today is a higher number than we probably would have thought it was going to be. But at the same time, I just say this: comparisons between this year and last year, you've got to be very careful. We didn't have a vaccine last year. We've now got we have 3 vaccines that all work very well, that protect to a very, very high degree against serious illness. And we've got 75% of the community with 1 dose, 45% of the community with 2 doses. So it's very different this year versus last year. There is something we can absolutely do about it beyond staying at home and following the rules, as important as that is, comparing the 2 years. This year, you can go and get vaccinated, and there are appointments available. So please go and get the AstraZeneca shot. Go to a pharmacist and get Moderna or get Astra. Book in. There are Pfizer appointments available. I'm not saying there aren't. But there's something all of us can do, something positive we can all do about that. So any COVID case is a concern to us. I'm not discounting that or trying to dismiss that. But there is something we can do about it to directly limit the spread of this virus and to protect ourselves. And that's getting vaccinated.
How far off that peak, though, are we?
Well, it depends how the next few days unfold. But the Burnett modelling is with you. You've got that in total. And there's a range. There are multiple lines. And it's sort of presented as waves, really. And it becomes clearer each day, but it doesn't necessarily become clear yet. We're still very early on, and that's why at just 45%. I'll give you one example, and then we perhaps might try and wrap things up if we can. New South Wales started to see a change in the trajectory of their curve once they got above 50% double dose. We're not at 50% double dose. We're at about 45%. So there'll be different points at which, hopefully, we start to see things change. But what's true, regardless of any modelling or any, dot on a line on a graph, if we all get vaccinated, we'll drive down these numbers and we'll protect more people from getting really seriously ill. If we all follow the rules, then and just find a way just to push through these next few weeks, because we're so close to ending this lockdown, then we'll be able to do just that, end the lockdown, get open, be free and be safe, and look to Christmas, and indeed many weeks before Christmas, a sense of normality, a sense of freedom, a sense of being with the people that you love the most, and a sense that whilst this won't be over, we'll be in a very different phase, a very different phase where you don't do lockdowns, big broad lockdowns anymore. You're much more targeted if you have to, and hopefully we don't have to be.
Are we still on track to, on Sunday, extend the travel limit, allow golf, fishing? It'll
depend how many people go and get the dose, go and get the jab. We're not at 80% today. We're going to have to look and see exactly when it can bounce around a little bit. We got to 70% a little bit earlier than we had predicted. Let's wait and see how we go. But again, as I've said a few times, the best thing you can do is go and get that first dose, and you will contribute to us getting to 80% sooner.
So when do you anticipate that decision will be made?
Well, we'll need to be confident that we're going to get to 80%. I think we can have a high degree of confidence about that, but 80%, it is meaningful. The difference between 75 and 80, that's a lot of people, that's a lot of protection, that's a lot of, if you like, that is a significantly different risk, if you like. But there'll be meetings. There's meetings pretty much every day, so there's always one thing or another for us to consider.
Just on that point.
Hopefully we get to 80 quick though. That's the point. But I can't give you an exact date.
Just on that point, speaking more broadly about the roadmap, do you think it's comprehensive enough? Do you think there's still too many unanswered questions for Victorians about?
Well, it's not in 7 volumes. It doesn't pretend to answer every question, because not every question can be answered. But what I can say to you is, I would hope no one found fault with that, because what I could tell you is that there's an enormous amount of work going on with ministers doing roundtables and very many meetings with different stakeholders and different people from different industries, trying to fill in some of those gaps. It's the beginning. It's not the final document. It's not a stone tablet that can't be changed. It's the beginning of that, and we'll infill. We will add things to it. So, for instance, I think on Sunday, I might have talked about the fact that we would have more to say about getting people who were in Sydney and stranded in Sydney home. Well, that's what I've done today. So that wasn't necessarily definitively determined or mentioned really on Sunday. We've just added to the roadmap today. Education Minister and Deputy Premier added to it yesterday with schools and mandatory vax, early childhood. There'll be more announcements, many more announcements that will fill in some of those gaps.
What about the arts and events sector? I know they're always calling out saying they're left off the roadmap. Will we know more about when they can?
Well, I hope they don't feel that way. Again, they may, and I'm not pleased about that. They're an incredibly important part of our economy, incredibly important part of our city and state and our identity. I know that the Creative Industries Minister, Danny Pearson, is engaging directly with a very wide cross-section of people from live music, theatre, all the way across that industry. And it's a big industry. It employs a lot of people, and it's been hit hard by this global pandemic. We have looked out for them. We'll continue to. We'll get them open. It'll be safe, and everything from, Harry Potter to the National Gallery and music in the pub and everything in between will be possible. May look a bit different, but we'll get them open and we'll support them, because they are, as you say, they're a massive part of our identity.
Victoria locked down much more rapidly than New South Wales did. On day 50 of their outbreak, they had 268 cases. We've hit day 50 today with 766. Why do you think that is?
It's a whole range of different factors. They didn't go through what we went through last year. Might be one reason. I think fatigue in our community is a very real thing. I'm not excusing bad behaviour, but I'm trying to explain it. That's why it's so hard, but so important that we just see this thing through. It's only a few weeks now, and we'll be open. We'll be able to end this lockdown. Go and get vaccinated. Please go and get vaccinated. It is our pathway out. It's how we get the place open. Who knows? Beyond that, though, Rachel, we'll probably never be definitive about it, but, change of transmission, the way things spread, there's an element of chance and good fortune or otherwise in these things also. Probably the speed with which they got to that 50% and other double dose thresholds. We're not having a go at them, but I think some of those things do start to shape the curve of this thing. Our main thing now is that we've all got to work as hard as we can to make sure that the numbers don't continue to grow really fast, because that's just going to make the job of our health professionals, particularly our nurses, our ambos, our doctors, much, much harder.
Is Horizon in a position to talk in more detail about vaccine supply stuff in terms of numbers? Can I ask you questions on that front, Jerome, or because there's a lot of uncertainty about the federal government's claims. What do you think?
Yeah, sure.
So, in terms of what General Fruin said on Friday about the October issues, I'll tell you what we've been told by the federal government. You tell us if it's right.
Okay.
We've been told that those issues were resolved on the weekend, and that October supply is significantly higher than September. So, September supply was 167,000 a week to state-run hubs. In October, that goes up to 205,000, then 234,000. That's separate to the hundreds of thousands of more to GPs, and separate to the 300,000 Moderna to pharmacies. So is October supply higher than last month? And is the 430,000 additional supply announced 2 weeks ago, has that started flowing through, or are there supply issues that are new?
Right, so let me confirm a few of those numbers. So normally we would expect to have had the full October allocation from the Commonwealth about a week or two ago. So how much we would receive every single week in October. The Commonwealth did a lot of work over the last weekend because there were delays in their confirmation, as I understand it, from Pfizer, which meant that we only received confirmation of our allocations next week and the week after that. 205,000, 234,000, the numbers that you've got in terms of Pfizer allocation. AstraZeneca's not so much of an issue. So we have those numbers. We have to, as a result of that, we have to scale down the number of doses we're allocating this week, next week, and the week after, until we see what the next set of allocations are going to be. We're expecting an update next week from the Commonwealth around the back end of October.
The second fortnight of October.
Correct. So we don't have forward visibility around what we'll get in the back end of October. It is really important for us to maintain our dose 1, dose 2 commitment, that we don't start burning into our dose 2 allocations and use them into dose 1s. What I can also say is last week we did 295,000 doses through our state clinics, through a combination of those standard September allocations. Remember all those additional top-ups that were being provided by the Commonwealth around various slings from different countries, all welcome and all gratefully received. We're at 295,000 last week. We could maintain that 300,000 or so rhythm a week for the next 2 or 3 weeks in terms of the scale of the clinics that we have and the demand that we have from Victorians to get vaccinated, because wherever we go with a pop-up clinic or a state clinic, it just disappears. The Commonwealth, I'm sure, would love to provide us with that additional capacity so we can keep going at 300,000 a week. That's what we want to go and do. We don't have enough, because we're getting 205,000 and 234,000, and after that, we don't know how much we're going to get.
So what we've got in October for the first 2 weeks is a significant increase on September, but our issue is certainty going forward, which is holding us back.
It's two things. It is less than what we've actually received in September, and it's less than what we need. And we don't have the certainty that we need beyond the middle of October. And that's not a criticism. We're all, we work very closely with General Fruin and his team. They're trying to resolve this puzzle as well. Our challenge on the front line here is we want to get as many doses into people's arms as possible. We have clinics all over the state. We have pop-up centres that we'd love to run. We've got 70 school pop-ups we want to run. We can't do that until we have the sufficient supply to put into those clinics.
And the GP top-ups, the 430 or 470, whatever it was, has that flowed through at the expected rate and at the expected speed?
So I don't have full visibility on the GP flow. I do know that a significant number of GP clinics were activated this week in Victoria, which is great news with Pfizer. There's more due to come in next week, which again, great news. And I think on Monday, Tuesday, we had Anthony here from the pharmacists again. Pharmacies in Victoria being activated this week and next week. All of that's good news. I don't have detailed line of sight on those numbers, certainly not in my head, but they understand that activation is going on. So there are more points of vaccination for Victorians to use. There are more GPs online. There are more pharmacists online. That's great. Our challenge at the moment is we want to desperately get to those. We want to get to those 80% first dose thresholds. We want to go beyond the 80% first dose thresholds. We want to get to those double vaccination thresholds. The more vaccine we get, the more we can get into people's arms, and the quicker we can bring those dates forward.
Can I then make the key point? So let's be clear. We're not here to have a debate and an argument with anyone, right? But the point here is this. Please don't wait assuming that there will be all the Pfizer you need and more. Take the vaccine that you can get today. Moderna is safe. Moderna works. Highly effective. It's been through all the approval processes. And over coming days and weeks, there's going to be plenty of it in your local community pharmacy. That's the first point. Secondly, we have AstraZeneca available. Again, safe for the vast majority of people. And we'll provide you with a health professional to talk about those issues so you can make an informed choice at one of our state clinics, or indeed pharmacies doing AstraZeneca as well. So too are some GPs. Please don't have a preference. Get the one that's available now. Get advice for sure, absolutely. But the one that's available now is the one that will protect you best, because you can't guarantee. There's no guarantee that you will get what you're deferring and waiting for. You may well find yourself in a very, very long queue and unable to get that vaccine. That's why we've pushed AstraZeneca so strongly, because it works. It absolutely works. And for the vast majority of people, when you go through that perfectly orderly, quite brief process to have a discussion about these issues, the judgment is made to take AstraZeneca. Don't wait for stuff that might not be there, or might not be there in the sufficient volume. It's not a criticism, it's just the reality we face. But everyone wants to get to these thresholds, and they want to get to them yesterday, and I understand that, but supply still remains a limiting factor unless and until people just embrace this concept. It's what I'm imploring them to do. I'm asking people to do. Do as the Chief Health Officer has made this point many times, and please respond to what I'm saying as well, and many others. The best vaccine is the one you can get today. It might not be Pfizer. They're all approved. They all work. They'll all keep you out of hospital. That's why it's so important that you book an appointment and go and get one of them. Not any one of them, any particular one of them, just one of them. And then go back and get your second shot after that.
On this issue, Premier, all existing bookings will get what they're booked for?
Yes, what will happen though, I expect, what Jerome's really speaking to, is that we've had to back off a little bit, and then you'll see as we round out this week, we're not going to do the 295 or 290 that we did last week. We may be a little bit below that. And our projected performance next year, like we wanted to go to 300 and above and maintain that. We've got some supply challenges. And again, it's not about blame, they're just facts. And that's why don't queue up for the thing that we don't have a lot of. Go and access the products that are safe, that have got the approvals, that have got all the evidence behind them. They work, they save lives. It could be your life that they save, or someone you love. Go and get Astra, go and get Moderna. Waiting for Pfizer, you might be waiting behind 12-year-olds, and not just a handful of them, like tens of thousands of people. And you may be waiting a very, very long time. I am not opening up, I wouldn't even have the supply to open up Pfizer for 60 plus.
Are you concerned that this supply issue may affect your ability to do these pop-up clinics?
Yes, I am.
These important targeted communities.
I am. I don't know that as we stand here right now. And again, just because you can be frank without necessarily inviting an argument, and I'm not inviting an argument. I was asked a question and I've answered it. And yes, we're frustrated, not at any one individual. We'd like all the supply that we need all sitting in a warehouse right now. That'd be one less thing for us to have to battle through. But some of these pop-ups will not be able to happen as soon as we wanted them to happen, because we just don't have the stuff. At the same time though, over time we have received the unused portion of Pfizer that GPs haven't used. And that's been about 30% of what they've been allocated over a long period of time. They only get about 7 out of 10 vials into arms, and the balance comes to us and we get it out in days. We move very quickly to do that. Who knows whether from a standing start community pharmacy will get all of their Moderna done. There might be some spare Moderna there that comes to us. Maybe some of these Pfizer concerns will be dealt with. Maybe there'll be another swap. I don't know. Maybe the Prime Minister will come back from the US and have good news about another deal. I don't know. I certainly hope that additional supplies turn up and that we can do more of that activity. But again, this is only an issue if people express a preference and go against all the evidence and express a preference for one vaccine over another, when what we know and what science tells you and what the doctors and the experts are telling you is that they all work. They'll all potentially save your life or the life of someone you love. By the way, they'll all get the lockdown lifted and they'll all get us open. So please don't shop around and have a preferred vaccine. Take any of the three. By all means speak to a health professional, but take any of the three and you will be protected. You are at a vastly reduced likelihood, like a fraction of the chance of finishing up in hospital.
thoughts on Victoria's construction sector missing out on targeted support from the feds when I understand New South Wales?
Well, having just tried to convince you that I'm not here for a fight, which I'm not, and I spent many weeks and months last year, well, not that much time. I think he might have spent more time fighting with me than I spent with him. But I am disappointed that the Treasurer has indicated that Victoria won't be getting what New South Wales got. Like, they closed their construction sector, and I'm not talking about, just to be clear, I'm not talking about individual income payments for workers. I'm talking about business support for construction businesses. As I understand it, New South Wales businesses in that industry during the 2-week shutdown were the subject, or were the recipients of some Commonwealth support. So the notion that you would support businesses in Sydney because they're shut down, but you wouldn't support exactly the same businesses in exactly the same circumstances in Melbourne, it doesn't really make any sense to me. So I'm a bit disappointed with that. I'll be raising that with the Prime Minister when he gets back. I have been speaking with the Prime Minister and with the acting Prime Minister on multiple occasions, texts and phone calls about the earthquake and things of that nature. So we're all working together, but I was disappointed to see those comments yesterday. And I would just say to Mr Frydenberg, you know, every time, I think Victorians are getting sick and tired of every time the Commonwealth Government spends $1 in Victoria, it's treated like it's foreign aid. Like we should bow our head and be grateful. No, we're part of this country. We pay our taxes. We pay more than our fair share of taxes. We create more than our fair share of wealth and opportunity and prosperity in our nation. And it is offensive for us to not be receiving the same support as other parts of the country got and continue to get, as if we weren't part of the country. I think I've made my position very clear.
Do you have any reflections on the commentary from Liberal federal MPs like...
Gee, we really are on a roll now, aren't we?
It's on a separate matter.
So this is why I had to leave at midday, you see. Yeah, so no, I've made my points there on behalf of Victorians, and I don't think they're unreasonable, and I put them in a measured way. I'm not interested in having fights with Mr Frydenberg, but it's always important that he knows where I stand on things, and vice versa. I was disappointed, and I hope that can be looked at, and I'll be raising that with the PM when I get a chance.
Federal MPs.
I've seen some of those comments. I think they speak for themselves, and I'm not going to be a commentator on the comments of other people.
On the protest?
Yeah, I've seen some of those comments, and I don't know that they necessarily accord with the views of the vast majority of people. Like, I know that Twitter's only, 140 characters? I reckon you'd find time to criticise the protesters, wouldn't you? I think I have, and I've done it. I've found time to spare more than a thought for police families and police members. I found more than a moment to speak directly to those who are doing the wrong thing and appeal for them to do something different. I don't think some of those comments necessarily serve the authors well. I certainly wouldn't agree with those things, but I'm not here to comment on any individual member of the federal government other than I have spoken about the Treasurer because he's expressed some views on behalf of his government. He's entitled to do that. I'm also entitled to say I don't reckon that's fair. Let's wait and see how that plays out.
Just on these protests, we have seen some quite sensational scenes. Do you think the CFMEU needs to take more responsibility for the actions of their members?
Well, I would just direct you to comments that the Chief Commissioner made yesterday. This crowd, it's a very diverse crowd. Not necessarily everybody who was perhaps wanting to look like a tradesperson is in fact a tradesperson. I think that union and other unions have been very clear about the fact that this sort of conduct's unacceptable. I think all of us, all fair-minded people, know and understand that we don't want to see this continue. And from my perspective, I think those unions have been very clear about what should happen and what shouldn't.
And what do you make of a police banning live broadcast of the media helicopter vision? Do you support that?
Well, the first thing, just so there's no confusion at all, the government had no involvement in that matter. Secondly, the briefing, so the Securities and Emergency Management Committee of Cabinet met last night and has met numerous occasions to be updated on these matters. I never thought I'd be potentially having a meeting about both an earthquake and a series of violent protests at the same time, but that's the year we're in, as well as pandemic-related matters. We got a briefing on a whole lot of different stuff. The important updates from the Chief Commissioner were that apparently protesters were using the live feed to essentially organise themselves. They were using it as a tactical weapon, if you like. Now, I know that's not the intention of any broadcaster to be providing that information, but that's the result of it. So then the Victoria Police went off and took the steps that they took. I think that there's been some further discussions about not preventing footage, but having some time delay so it's not live. Again, this is not a matter for the government. I'm not going to interfere in the tactical and the operational decisions and imperatives of the Victoria Police. They do what they need to do to keep all of us safe and to keep their members safe.
Are you comfortable?
That's the advice I have.
Are you comfortable with their response to how they've handled this protest?
I'm
overall?
comfortable that Victoria Police do whatever they think is necessary, because they do, in my experience, they do reasonable things to keep their members safe and to keep the public safe. And I understand this could be quite frustrating for a media organisation. I'm not pretending it isn't. Sorry.
We went to court and we won, so we can live feed now.
Well, there you go. So, well, why didn't you tell me that at the start? I'm here justifying something that's just been rolled over by a court. Sorry.
I was trying to put my hand up and tell you. We won.
Just back on the business.
You're in a funny mood today, you lot, honestly.
It's a protest.
You really are. Well, maybe. But anyway, I was going to leave here 35 minutes ago, so that's going well. And I'm here arguing with people I said I wouldn't argue with. I'm defending decisions that have been knocked over by a court. Anyway.
Very quickly.
And it's only, what is it, Thursday? Yeah.
Very
Anyway.
quickly back on the business support issue, if
Yes.
we can. Is it correct that Victoria was offered to go 50-50 with the federal government and rejected that in favour of the federal government going 100% on income support and the Victorian government going 100% on business support?
In relation to this issue or broadly?
The construction support issue.
I
that
couldn't tell you. I can try and come back to you. I know the treasurers have spoken. I've not had a conversation with Mr. Frydenberg or anything or anyone, and I wouldn't want to call into question the accuracy of whatever you've been texted from whatever member of the federal government. But I'm not sure. But I can chase it up for you.
Are you hopeful of reaching some sort of?
Absolutely. I would just hope that we get the same treatment as what New South Wales did. And as I understand it, they got some assistance. I'm not saying 100%. Like I would hate to think that we're going to be sending out next week payments to small businesses in the construction sector where there's a note from me or from the Treasurer saying this is half what you probably thought you were going to get because the feds wouldn't go 50-50. I don't want to have to do that. You know, I hear a lot about the party of small business and all this sort of stuff. A lot of these people will be small businesses and they'll be hurting because of this necessary but very difficult decision. And my understanding, if I'm wrong, I'm very, very confident that Mr. Frydenberg will point that out. But I think the record shows that New South Wales, they did get some support. We should just sit down and not have an argument about this. We should just treat everybody equally and fairly, and let's look out for those businesses. Again, that's separate to workers being paid. That's another issue, and we are paying for those that are in non-hotspots, and we've done that all along. Does that make sense? That's not a blue for its own sake. I hope it's resolved today. It'd be fantastic. I'll be the first one to say that's great news if we can do a partnership to support those businesses. They're going to need it.
Really quick question for Jerome, if that's okay.
Sure, no worries. We're well into overtime. It's all good.
Just on the deaths today, are any of those linked to the Meadow Heights aged care facility?
I think out of respect for the families, Rachel, I won't comment on that. Actually, but I'll pick up on a completely separate issue though. Just on you mentioned the border closed in New South Wales. That was the 20th of July that we suspended red zone applications. 23rd of July, extreme red zone was introduced, so 2 months, and obviously the changes made today.
Can you just confirm something for me? We know majority of cases are from Melbourne's northwest, but I've got reports of 80% of cases deriving from 2 LGAs in Melbourne. Is this true, and if so, could we not consider a more targeted approach at lockdown?
No, I don't think that's. I'll come back to you on the detailed numbers, but we don't have that degree of concentration. So we have around 10 LGAs of concern across the north and west. But what we've also seen over the last 2 or 3 weeks is a significant shift in the epidemiology in each of those LGAs. So absolutely, Hume and Moreland, we're seeing significant increases. Hume is, as I said earlier today, absolutely driving the biggest number of cases in totality, but we've seen real differences in the way that Wyndham's been performing, Hobson's Bay's been performing, Melton's been performing. So we do take, in terms of the local teams we have on the ground, the wonderful work that's been done by so many local agencies, local health services, co-health, our council partners and many state agencies. It is very nuanced on the ground around this particular challenges that we deal with. But as we've seen, particularly with, for example, construction, we continue to see movement across the city, and the southeastern clusters that we're seeing, we're very, very clear, derive ultimately from the northern clusters, derive ultimately from the western clusters. So we have cross-city movement.
Do we know if those 80% of those cases derive from those 2 LGAs?
No, I'm happy to come back to you in the next couple of days with what those numbers look like. 80% sounds a bit too over the top on the numbers I've got. We've only got 60-odd% in all of the northern suburbs. We've got 20-odd% in all of the western suburbs. So it's certainly not that degree.
Yeah. Okay. Great.
And just one more question on deaths. Have we had anyone in our outbreak so far in Victoria who's died having been fully vaccinated?
I believe we have, but that person had underlying conditions.
Was that one of the most recent deaths?
I'm not going to speculate on that. Okay.
Thanks very
Good.
much.
Thank you all.